Welcome back to Therapy Thursday. It's getting warm out. All we're allowed to do really are outdoor activities. One of the things that we see a lot of are tennis players coming in around this time of the season with a lateral elbow tendinopathy, aka tennis elbow. It can happen in lots of sports. You see it in golfers as well, but regardless, it is pain up around the outside part of your elbow and then down this way a little bit in a group of muscles called your extensors. So it's to do with repetitive motions like this, like a backhand in tennis. Very common. We're going to show you a little trick to help you get rid of it. Oftentimes we start people on the rehab process targeting that extension motion with something called TNT, or tendon neuroplastic training. It's a fancy word for saying resisted extension like this, nice and slowly, to try to preferentially load that tendon. At some point that tends to plateau, and we find the thing that sort of gets people over the edge is targeting a secondary muscle that's often overlooked with tennis elbow. It's a muscle called the supinator. Sort of runs in this direction, but there's been studies as old as 2004 that have showed that it's implicated in tennis elbow. So when we add in a supinator exercise, it often takes people over the edge and cures their ailment. So it's the same slow loading protocol, but instead of an extension, we're going to do supination and pronation. We're going to use a pretty heavy weight, and you're going to rest your elbow and forearm along a surface like so. We often tell people to do this with a hammer so that more of the weight's at the top end, but you're going to take a 3-second count into supination and then twist it all the way back down with a 3-second count into pronation. So you're really working that muscle concentrically like so by supinating, and then eccentrically by pronating. We'll typically tell people to use a fairly heavy weight. It's okay to do this exercise into some pain. We'll ask them to do 3 sets of up to 10 reps. Try that next time that you get pain in the outside part of your elbow and you're frustrated because it can last for a really long time. In our experience, this single exercise is very effective at getting you past the plateau. If you like this video, make sure you hit subscribe, hit the bell to be recommended videos every time that one comes out, and we'll see you next week on Therapy Thursday.